Sweet. All right, and we're live. Mary, is there a name for the day after Christmas? Because there's Christmas Eve.
Boxing Day.
Boxing. Thanks, Leah. Hey, everyone. Joined here today with Dr. Rose. Dr. Rose, thank you so much for making the time.
Yeah, happy to be here.
Yeah, I'm happy to be here too. This is gonna be fun. So today we're just live right now. We got some people joining in, so welcome. We're gonna be talking about gut health, and then we're gonna dive into probiotics. There's actually a ton to learn about probiotics. We're gonna be talking about some of the history, best practices, gut issues, all that sort of stuff. So the theme today is gonna be gut health. We're gonna talk about 30 minutes a piece. Disclaimer, everything we talk about, none of this is medical advice. This is just for education purposes only. With that said, Dr. Rose, why don't you give some background and context on your experience with gut health? I believe you've written a book on gut health as well. So kind of the expert here. Tell me more.
Yeah. I think that probably in most functional medicine practices, gut health is a pretty big component. What happened in my practice probably 10, 15 years ago was that I just noticed that a vast number of people were coming in with whether it was IBS, chronic constipation, inflammatory bowel disease, GERD, reflux. It just seemed to be like that whole section of health seemed to be a good percentage of the people coming in. And then another good chunk was also kind of mental health, emotional health. And so that's kind of what ended up spurring the book topic, which is the mind-gut connection and how the nervous system, the emotions play a role in gut health and vice versa. So that was, so that book came out about 10 years ago.
Okay.
And so what happened is then I needed to do a lot of research around gut health for the book, which was really a great opportunity and really kind of spurred me to learn even more than I already knew. And then it just kind of became more and more of an interest and more patients coming to me specifically for gut health, et cetera. And the beautiful thing about kind of having a medical practice is that you learn from your patients. They come in, they have, something that's kind of a little bit different, and it spurs you to do research, and then you learn, and then you have that information available to the next group of patients. So,
Cool.
Yeah.
Gotcha. All right. Thanks for sharing. What's like, if my mission was to mess up my gut and the gut make my gut as unhealthy as possible, what are the top 3 things I should do to screw up my gut health?
A diet extremely high in processed sugars, a diet extremely high in alcohol consumption, and let's see. I mean, there's just the top 3, I guess I would say, like probably super high amounts of gluten and dairy.
Okay, so a ton of pizza, a ton of donuts, and
soda. Oh, you got to do soda, and you got to do lots of bourbon.
Gotcha. All right.
Maybe beer. That's probably worse.
Beer is the worst offender to gut health.
Well, you've got gluten and you've got the alcohol.
Why is gluten?
Gluten is just extremely inflammatory, and so everybody has different levels of sensitivity to gluten, but on some level, it tends to be if you're consuming large amounts of it, you're going to end up with inflammation at the gut level. And so if that's not balanced by healthy fiber and adequate water intake and all of that, then you're just going to end up kind of perpetually more inflamed at the gut level, in my experience.
Gotcha. How does someone know that they have gut health issues? Like, what are the symptoms that should make someone think, all right, I should do something about my gut health?
So when I'm meeting with somebody, we're talking about digestive health, I always do kind of a top to bottom review of systems. So I start with, are you having symptoms of reflux, heartburn? Sometimes there's silent heartburn where it's not that classic burning, but it's like it's a dry, kind of quite frequent cough or a tickle in the throat. Sometimes it's more of a pressure, and that's why kind of the whole People think they're having a heart attack, and it's really heartburn. But if you suspect that you might be having a heart attack, it's good to go get it looked at. But that's why it can kind of feel more like just a pressure, not that classic burning. So we kind of ask about symptoms about that: nausea, vomiting, excessive belching or burping, and then bloating, right? So there's a lot of people walking around thinking that like feeling bloated most of the time is normal. And they've just lived with it for so long. So assessing somebody's level of bloating, distension, feeling like there's a brick in the stomach after you eat, like nothing really moves, and then actual abdominal pain, cramping. You just kind of I keep going lower and lower, right? And then what are your bowel habits? How often are you having a bowel movement? Is it complete? So does that answer your question? I mean, all the way down to hemorrhoids. Is there blood in the toilet, right?
Gotcha. So yeah, the gut affects a lot. For the 11 people who are watching, welcome. Feel free to throw in comments. Oh, that's not very nice. So what? Lost my train of thought here. With I guess start like, why is the gut, like, how does the gut affect so many other things in the body?
So there's a lot of receptors throughout the gut. So there's receptors to hormones, there's receptors to neurotransmitters. And I think we're just kind of at the tip of the iceberg in terms of understanding how the microbiome in the gut, those beneficial microbes, organisms, really kind of impact those receptors and therefore neurotransmitter balance, hormone balance. There's also something called the enteric brain, and it is part of the central nervous system. And so we think of the brain as being in the skull, but there's this whole second brain that's in the gut. And so it's this real intimate relationship between the nervous system, the brain essentially, and the gut. And it's a two-way, it goes both ways. So thus, like, yes, anxiety, for example, can affect your digestion, but also your digestive health can affect your mood, whether it's a tendency more towards anxiety or depression. So I think we're just kind of at the beginning, research-wise, of how that works, what that interplay is.
Gotcha. Okay. What are things people could do? Like, what are the easiest things people could do on their own to improve their gut health? And then what are like noticeable improvements they might see after, doing these things for, say, 3 months?
Right. So it's a little bit of a difficult question because we are all unique. We all have different baselines in terms of our microbiome, in terms of food sensitivities. So in an ideal world, someone is getting tested, and maybe we can talk about what that testing can look like. But if somebody is not able to, or wants to kind of get going on this before having the opportunity to get a gut health panel, then like vegetables and fiber, I think, is kind of maybe underrated.
Why is fiber good for the gut? Like what's
so insoluble fiber, one thing is that it basically can bind toxins. Really, it can help to bind toxins, and then they're more easily eliminated through the stool. The other thing is that fiber just can kind of bulk up the stool, therefore making it easier to pass. So a lot of my patients have different levels of constipation. And for most people who tend to be constipated, if we increase water intake and increase fiber content in the food and or add in an insoluble fiber supplement, bulking up the stool makes it easier to pass. And so if you're pooping every day and they're complete, so I'm not talking rabbit pellet poops, I'm talking about like healthy formed stool, then again, for most people, not everybody, but for most people, then your bloating and your discomfort is going to go down. So there's 3 things right there. There's adequate hydration, there's vegetable, therefore fiber intake. And then if that's not quite enough, or you're traveling during the holidays, for example, and it's hard to get like the right amount or type of vegetables that you want, an insoluble fiber supplement can be great. So those are 3 things. What was the question? 5 things that you can do to benefit your gut?
I think I was just asking in general, like, what are the things you could do to benefit your gut? I think that was a good list. What is, okay, like with bloating, because this is something we hear a lot in the practice. Patients, they're getting bloated.
Yeah.
What actually causes bloating? What's going on in the gut that makes someone bloated?
So most of the time it has to do with these microbes. I could say bacteria, but it's not, they're not all bacteria, but they are all anaerobic organisms. So there's these kind of microscopic organisms in the small intestine and the large intestine, and they most of them are supposed to be there, but only in small amounts. When somebody is maybe not eating the right food for them, or there's an imbalance in that microbiome, we get too many of those organisms. And some of those organisms secrete hydrogen gas, some of them secrete methane gas, and then a smaller percentage of them can also put out hydrogen sulfate gas. It's the gas that causes the distension. It's the gas that causes the discomfort. And so it's, again, super common. Some people realize that it's not normal and not ideal. And again, I think a lot of people just have been dealing with it for so long that they just think that's what they expect. And some people will have bloating primarily after they eat and then it dissipates. And other people, unfortunately, are living with kind of some grade or some level of bloating most of the day.
Okay. What are they doing to like what can you do to stop bloating? Is it just the foods you're putting in your mouth, or what are, because I know a lot of, like, if you have bad bloating, it can be really uncomfortable.
Yeah.
Like, the way you look, like, what are like really actionable things you can do to take care of bloating?
One nutrition or dietary experiment that you can do is something called a low FODMAP diet. It's F as in Frank, O, D like David, MAPS, MAPS. And it stands for fermentable oligo di mono something polysaccharides. These are basically starches that aren't easily digested. So a diet that's low in these starches can, for some people, minimize bloating. It's kind of I think of it as like a low-hanging fruit for people. They can do it on their own. They can just experiment. Some foods that tend to be really high in FODMAP starches would be onions and garlic, apples and pears. Sorry, what? I lost your sound.
So cut onions, pears, garlic out of your diet if you have.
As an experiment. And so you can easily Google low FODMAP diet. Anybody can find that. And it's not intended to be a forever way of eating, but if you want to see if you're sensitive to those foods, it can be a way to determine, to see, if that's playing a role for you at all. And then a lot of people will end up being relatively strict on a low FODMAP diet for a month or two. And then I usually counsel people to kind of slowly reintroduce. And so people will often end up on more of like a modified low FODMAP diet where they find they can tolerate most of those foods, at least in moderation. And really the ones that they have to stay away from are, they can't really have like 2 apples a day. That's going to trigger bloating, but otherwise they're okay. So Gotcha. That is one thing that somebody could do on their own.
Okay. All right. That makes sense. Switching topics up here a little bit. Patient goes to a gastro with IBS. Patient goes to a functional medicine doctor with IBS. How do these two providers treat the same thing differently?
So usually if you go to a gastroenterologist, they much of the depends on what you're presenting with. So you could have IBS-D, which is the diarrhea dominant form. You could have IBS, which stands for irritable bowel syndrome. You could have C, the C version, which is constipation, or you could have mixed, whereas you're alternating diarrhea and constipation. So a gastroenterologist most likely will do a colonoscopy, or also known as a lower endoscopy. And what they're doing with that is they're ruling out something more serious. They're ruling out something like cancer, inflammatory bowel disease, which is Crohn's, or ulcerative colitis, or a different type of colitis. And if those things are not detected on the colonoscopy, then IBS is considered a diagnosis of exclusion. So there's nothing else is evident. And so you're given an IBS diagnosis. And again, maybe you're given a recommendation for Miralax, which is a over-the-counter laxative. Some gastroenterologists might tell you to follow a low FODMAP diet. They also might say that it's stress related, and they might just tell you to deal with your stress, or to go on something like Wellbutrin. Functional medicine, we are most likely going to want to run some kind of comprehensive stool analysis. So a test that is a stool test, and we're looking at the microbiome in a lot of detail. We're looking at levels of inflammation at the gut level. We're looking at if there's any occult blood, like blood that you can't visibly see in the toilet or in the stool, but it's there. We're ruling out all sorts of infections. So bacterial, viral, parasitic, candida, or yeast. So again, in an ideal world, we can get all of that information, and then that also helps us rule out other things like inflammatory bowel disease or infection. And IBS can also look exactly like something called SIBO, small intestine bacterial overgrowth, or even SIFO, small intestine fungal overgrowth. So they can present very similarly: bloating, constipation, diarrhea, cramping. But that is an infection. Like the bacterial overgrowth or the fungal overgrowth, those are infections, and those do require some kind of antibacterial or antifungal treatment, like an antibiotic or an oral antifungal. So it's just, I guess I would say, you come to a functional medicine provider with a previous diagnosis of IBS. Like, we are going to dig deeper. We're going to make sure that it is IBS. It's not something else. Most of us are not going to have the training or ability to do a colonoscopy, but we have these other tools. And, we are going to see, is there a nervous system component to the IBS? Do your digestive system symptoms worsen when you are stressed or anxious? We are going to look at all sorts of things, from food sensitivities to, autoimmune conditions, all sorts of things that can potentially kind of contribute to this IBS picture, and just kind of keep digging deeper and individualize it. Again, everybody's different, but we do have the benefit of having these advanced tests, which can help us together with the data, with the results from those tests, piece that together with the person's history to kind of figure out what really is going on.
Gotcha. So it sounds like the diagnosis of IBS is almost like I don't want to say out, but it's like, okay, you don't have anything else, we're just going to give you this.
It is.
For.
Yeah.
Okay. So so do patients in like conventional medicine, like how often are they just getting an IBS diagnosis and told, sorry, that's just how it is, nothing more? Is that the case?
I think that's pretty common. I mean, the way that kind of conventional medicine is right now, like if somebody's symptoms are, if they persist, if they come, like, say 3 times now to their primary care doc, and, again, the Miralax hasn't worked, the, whatever kind of suggestion was made hasn't done anything, they will probably be referred to gastroenterology. Yeah.
Gotcha. So when should a patient go to like a conventional gastro versus go to a functional medicine doctor who, like yourself, who specializes in something like gut health?
So, if there's significant amount or frequent blood in the stool, and or mucus, and or so to me, those can be red flags for inflammatory bowel disease. Again, inflammatory bowel disease is kind of the umbrella term for ulcerative colitis, microscopic colitis, Crohn's disease. I really like having a person. I treat a lot of people with inflammatory bowel disease, but I really want them to have that colonoscopy. That's kind of the only definitive way to diagnose it. And even though we have a lot of tools beyond like biologics for treating inflammatory bowel disease, I really like using the gastroenterologist, the colonoscopy, to get that diagnosis and to get a baseline level of inflammation, ulceration, the location within the colon of what is affected, because they hopefully will have a repeat colonoscopy in 3 or 5 years, and we're going to see if our treatments, what's happening with that. And it's just really, I want that diagnosis. I want to kind of know what we're dealing with before we begin a comprehensive treatment plan. So I guess I would say blood and or mucus, and red blood again is usually hemorrhoids, like a few, red blood on the toilet paper. I'm not saying that hemorrhoids are not a concern, but that's not necessarily indicative of an inflammatory process happening higher up in the colon. So I would say those two are times to go to a gastroenterologist. It never hurts to have a colonoscopy. Again, I always like it when people come in and they've already had that, because it just gives us a framework of what's going on.
Sure, that makes sense. Okay. Is there ever a scenario where someone doesn't need to go to a gastro, or do you say that these two should always work together? Like you should always have your conventional doctor and you should always have your functional medicine doctor?
No, I don't. There's a lot of times when I don't think somebody needs to go to a gastroenterologist. I think kind of chronic bloating, chronic constipation, they can go straight to a functional medicine provider. In terms of the upper GI, like again, I really don't mind having referring somebody for an endoscopy, or someone coming in already having had the endoscopy, again, for like baseline. Obviously, if you're coughing up blood, that, please don't come to me, go to urgent care. But what other times can they come to us? I mean, most things, I think they can kind of start with us. It's really when it's like, you're the blood, the mucus, you're like really, really debilitated, and it's an urgent situation, that it makes sense to at least start with urgent care.
Gotcha. Okay, that makes sense. How confident are you? Like if someone comes in with constipation, how confident are you that you could fix their constipation if they're willing to make any lifestyle change? They're super motivated to fix, this gut issue.
I'm pretty confident. I've got a lot of tools,
and give me a number, like what, like 90%, 99%,
80%? I am 90% confident that I can improve their bowel habits. Now, they might not end up having like, a stellar bowel movement every day for the rest of their life, but I can 90% of the time I can improve the quality and frequency of the bowel movements.
Gotcha. And how do you do that?
Sometimes it's dietary modifications. Sometimes it's figuring out if there is something like SIBO, small intestine bacterial overgrowth, going on. And that if that's happening, it means that there's these microbes that are putting out methane gas. Methane gas slows the motility of the gut. And when you slow down the motility of the gut, there's no longer what we call peristalsis. So there's no longer that muscular contraction. And so nothing moves. So if we kind of get to the root of that and we treat that, and then we bring back some motility, then they're going to start going again. There's nutraceuticals. Again, everybody's a little bit different. So say the person doesn't have SIBO, they just have slow motility. We're bringing in things like magnesium, fiber. If we have to, there are natural laxatives out there that I don't like to use long-term, but I will use short-term. Sometimes the tools that your grandmother told you about, like prunes and prune juice, that can do the trick. So there's a lot of investigative work that goes on of why is this person constipated and why is there slow motility, and then once we kind of figure out why, we can start playing with different tools.
Gotcha. Okay. How often do you use, a lot of patients come to us because we have access to a lot of peptides. How do you use peptides in helping patients improve their gut health?
Gut health. So two of my favorite peptides for gut health. One is actually BPC 157. And this is a peptide that it's actually a sequence of amino acids that mimics part of our own stomach acid. And it has, the way that peptides work in general is that they have affinity for different parts of the body, different tissues. And so BPC 157 has an affinity for the gut. It's probably more well known for its affinity for connective tissue and joints and inflammation in connective tissue and joints, but it does also help to heal inflammation in the gut. So I really like using it for that. I've had some good success with that. And then a second peptide that I like to use specifically for leaky gut syndrome is larazotide. And that's actually an oral peptide. And that was originally studied in people with people who have celiac disease. But it has this ability to heal what we call tight junctions, which are, so in leaky gut syndrome, the enterocytes, the cells that make up the lining of the gut, they normally line up together like this, and they are permeable enough to let nutrients into the bloodstream, but close enough to keep things that we want to keep in the stool. So proteins, foreign things, just larger molecules that really shouldn't get into the bloodstream. So a tight junction is like this, and then with inflammation, it's like this. And so things get through that shouldn't. Larazotide is a peptide that can come in and help to heal that gut, heal that tight junction, bring it back together. So those are probably the two that I start with, the two peptides that I'll start with a digestive health case.
Gotcha.
What happened?
Not sure. We're still live.
Hello, everyone.
Little technical difficulty.
I guess so. He just like completely left. Like I can't see his. Okay, well.
Do you want to stop this feed and resume when we can?
Let's just give it a minute. Maybe. Is there anything that you would add on to the conversation that hasn't been asked yet?
we could keep talking a little bit about leaky gut if you want. So one thing I do, because a lot of people have heard of leaky gut syndrome, because we're talking about something that's happening on a cellular level where these cells that make up the gut lining have a level of inflammation. There's not always actual digestive symptoms associated with that. So people aren't necessarily like experiencing leaky gut syndrome on a gut level. But what happens when there is that level of inflammation is that the immune system, like the kind of first responders of the immune system, detect these molecules that come into the bloodstream that are not supposed to, right? These are molecules that should stay in the stool, but they pass through into the blood. And the first responders of the immune system go into attack mode, and they alert other cells in the immune system throughout the body that the body is under attack. And so that triggers an inflammatory response. And that blood goes everywhere in the body. Those immune cells are everywhere in the body. And so that inflammatory response can happen anywhere in the body. So it can happen in the skin, it can happen in the joints, it can happen even in the nervous system, it can happen in the gut. And that's the underlying theory of autoimmunity or autoimmune conditions, that the body is attacking itself mistakenly. And so oftentimes people come in maybe with an autoimmune condition, maybe with other signs or symptoms of inflammation. And it's like, well, how do you practice root medicine with that? Rather than just throwing, kind of some kind of pharmaceutical anti-inflammatory at it. And oftentimes part of the answer is to assess if there is a leaky gut process going on, and if so, start to heal that. So, the cliche that everything starts with the gut, I think there's some truth to that. So it's not just like, well, what you eat, we are what we eat. That's true too. That's a cliche that's also a little true. But I think it all starts with the gut can really be accurate and applicable when we're talking about any type of inflammation. You don't have to have an actual diagnosis of an autoimmune disease. There can just be an inflammatory process going on. And we want to make sure that those tight junctions are tight, that there's not a lot of leaky gut, of that leaky gut process happening.
Interesting.
What else should we talk about?
Questions in front of me.
Well, I like some of these questions about like why people sometimes feel more bloating, more sugar cravings around the holidays. Can we talk about that?
That's a good one.
That's a good question. I like that question. So it's certainly true. I think that, whether you have as a baseline, you tend to deal with a lot of bloat, or maybe you don't, but then now you do between Thanksgiving and New Year's, you're like, you're just walking around feeling kind of meh. It's definitely the majority of people are eating more sugar, more alcohol, more processed carbs this time of year. It's just, the break room at the office, everyone's bringing in cookies. You're going to your in-laws. It's rude to not have that piece of pie or cake. It's just kind of, it's in the culture. So I think that bump up of, again, sugar, processed carbs, and alcohol is a big part of it. I also think that our stress level is higher almost collectively. And there's just busyness, there's financial stress, there's dealing with family that you don't really want to deal with the rest of the year. You don't have to deal with as much as you do during the holidays. And so the adrenals are taxed, and we're just having some emotions that are not always so comfortable. And I guess, trying to feel a little better and eating sugar and having more alcohol is often a way that we as humans tend to self-medicate. And when we're stressed, we're not necessarily digesting as well either, right? So we're less relaxed. Again, you're at that dinner party where you don't feel so comfortable. You're with that uncle who you don't agree with politically, and you are in fight or flight mode. And when you're in fight or flight mode, that's not the rest and digest mode. That's that your body is not primed to digest your food well.
Noted. No.
Yes, yeah. So I guess, the next question would be, what do you do about it? There you are.
Hey guys, I don't know. My computer just took a vacation, but we reset it. We're all good. So yeah, did you guys transition into the probiotics episode?
Not quite, but we can.
Cool. Yeah, we got like 20 minutes here. Let's shift back into let's start talking about probiotics. So
Okay.
Dr. Rose, why don't you start off with talking about what is a real probiotic? What are probiotics? So
they're live organisms, they're live microbes, and there's different ones, like lactobacillus, akkermansia. They are organisms that are meant to sort of match what we have on our own, right? So that it's like basically what we have, the same organisms that make up our own microbiome. There's also prebiotics. You will also often find products that maybe are just a prebiotic or a pre and probiotic, and that's like food for, that's like, because these are live organisms, you need to feed the organisms. And so it's usually like inulin or some type of food essentially to keep them alive. So it's usually like a fiber that often is what the prebiotic will be.
Gotcha. So sorry, what's the difference between a probiotic and a prebiotic?
So the probiotic is the organism itself. It's the live organism that's going to kind of hopefully sort of match your own microbiome. And then the prebiotic is not live. It's food. It's food for the organism, for the probiotic. Gotcha.
Okay. So if someone's just taking a probiotic, is that useless? Or do you need to take both?
I think, again, if your diet is pretty rich in fiber, you're probably feeding both your own microbiome and the probiotic supplement that you're taking. I think it also depends on the specific nutraceutical supplement and how it's formulated in terms of shelf life, and is it refrigerated and all that. Like, does that specific probiotic require a prebiotic in the same product or not? And I usually leave that up to kind of the manufacturers. I mean, the companies that we use are, I think of them as kind of like physician grade brands. Like this is like all they do is formulate these, and I have trust in these brands, and I see good results clinically. So usually if a product from one of these brands is formulated in a certain way, I'll trust that what we're wanting to take a probiotic supplement that actually is what it says it is on the label, that it's alive and it's the same, kind of quantity that's listed on the label. It's not that easy. So people will often say, like, can I pick up a probiotic from wherever? And I'm usually hesitate to say yes to that. Now, if somebody says, can I pick up a B complex or vitamin C from anywhere, that's usually it's a little safer. It's not that hard to formulate to manufacture vitamins. It's much harder to manufacture probiotics that are actually what they say they are, and that they are alive by the time they actually get to you.
Okay, so why do some probiotics need to be refrigerated and some probiotics don't? And if you're taking a probiotic that is not refrigerated, is it even a real probiotic?
Again, that's kind of a manufacturing question. I don't know the specifics, except that Most probiotics do need to be refrigerated. That kind of helps with keeping them
So if
viable.
you're taking a probiotic that is not refrigerated, are you not actually taking a real probiotic?
No, there are some specific ones that are made to stay alive at room temperature, but they need to specifically kind of say that. You need to kind of know that from the company that they are not intended to be refrigerated. Again, it's very brand specific. So most probiotics, most high quality probiotics should be refrigerated, but there's a few in particular that I will give my patients who travel a lot, who whether travel a lot, or they literally have a long commute and they like to take their probiotic in the middle of the day and they don't have access to a refrigerator. And it's just easier for them to have one that they don't have to keep refrigerated. Mm-hmm. But I can literally think of one like that. So for the most part, they should be refrigerated.
How often are patients coming in and they're just taking crappy, no good prebiotics?
So I can't really speak to I don't know if they're crappy, right? I don't know.
I guess how often do you see a new patient? Because a lot of people take probiotics. Even before I even started working on MedMatrix, I was I took probiotics. As you think it's okay, it's good for your gut. But how often are those actually I'm just curious, because you're talking about there's very few select brands that you trust and so on and so forth. How often are the patients coming in who are taking probiotics and you're yep, that's a great probiotic, keep taking it, versus oh no, that's not actually a good probiotic, let's get you on a different one?
I guess the way that I think of it is I don't really know. It's not there's certain brands that I know are crappy. I know ones that I really like, but I just don't have, I guess the way that I would phrase it is I don't have faith in a lot of the products out there. I can't say that it's not going to work for one person. It might be great for that one person, but we are all so unique and our microbiomes are so unique that I think kind of a catch-all of just taking a lot of these probiotics that you can now get, on the shelf of any CVS. Mm-hmm. I just don't know. So I can't make a definitive statement that they're bad for you, but I just can't really speak to it. I think that the kind of common misconception is that we should all be on probiotics all the time. And the other one is that if I'm bloated, that I should take a probiotic. I think those are not always accurate statements.
Okay. Can you tell me more? what you mean by that?
So, depending on one's diet, depending on one's baseline microbiome, it might be beneficial to take a probiotic every day, but it's not necessarily something that we all need to do no matter what.
Right. When should someone take? We'll get into how probiotics can cause more issues, but when should someone take a probiotic?
If you have been on an antibiotic afterwards, you can take a probiotic. Now, if you're on an antibiotic, there is one type of probiotic that is safe to take, or not safe, but it's effective while you are on the antibiotic, and that is Saccharomyces boulardii. The reason why is because it's actually a yeast, and so it's not going to get killed off by the antibiotic. So Saccharomyces boulardii is a probiotic, and if you specifically look for that probiotic, if you take that while you're on an antibiotic, then it can benefit your gut microbiome while you're doing the antibiotic. So anytime that's the antibiotic topic. And then if you're having, if you have some kind of diarrhea, right? If you have some kind of infective diarrhea, that it can be really beneficial to take a probiotic during that time and even after.
Okay, so this is interesting. So those are the two scenarios you described when you're either taking antibiotics or having diarrhea. These are small parts of your life. So should you be less often on a probiotic than you are more often taking one? That makes sense.
I mean,
Like if
that's
someone's
usually
been
how,
taking a
yeah.
probiotic, if someone's sorry, let me say it a different way. If someone's been taking
Yeah.
a probiotic every day for the last 5 years,
Yeah.
not a good thing.
I can't make definitive statements like that.
Generally.
Everybody's different. So, no, it's not necessarily a bad thing. If they feel better on it, if they feel like they digest better, that they're less bloated, that they're pooping better, then yeah, I think it is like a good idea for them to be on it.
Okay, so what if you were taking a probiotic and you're still bloated, your poop is still messed up?
Then one of the first things I do is I have them go off the probiotic because
Okay.
it could be making things worse.
Gotcha. How can a probiotic actually make someone's gut issues worse?
Because if you have what we call dysbiosis, where your microbiome is out of whack, where those organisms that are in your gut are either like in the wrong ratio, you have ones that are too high, others that are too low, and those are just off, that sometimes bringing in exogenous organisms, which is what the probiotic is just going to exacerbate the situation. And so it's again, if we're trying to figure out why somebody is bloated or what factors are contributing to the bloat, that's an easy one to start with. Well, let's just take that out of the equation. Let's see what your baseline is without taking a daily probiotic. Maybe you are still bloated, and I'm not saying that's going to be the only reason that they're bloated, but let's at least take that factor out, that variable out.
Gotcha. Okay. What advantage is there to coming to a functional medicine provider and like yourself and like getting a full workup and like getting a personalized probiotic recommendation versus just kind of doing some research and finding a good brand online and ordering that?
Well, again, as you can tell kind of from this whole conversation, like I really like when we have the opportunity to do a test where we can actually do a stool test and we can actually get kind of a readout of what does this individual's microbiome look like? Which organisms are kind of too low? Which ones are too high? Is there an infection that we need to treat? And if we treat the infection, many times if the person is eating well for them, then the microbiome is going to eventually kind of balance itself out. So that's my preference, is that if they come to me and then we can really kind of figure out specifically what's happening in your gut rather than taking kind of a generic probiotic. Once I know what's happening with this person's microbiome, I can specifically say, oh, look, you're low in Akkermansia. Let's bring in some Akkermansia and let's see what happens. Or I can tell, oh, it looks like, you're I can kind of tell that, there's really kind of low levels of short chain fatty acids here. And you tell me you're eating a lot of fiber, but we somehow need to bump that up in your diet, because I can kind of tell from this panel that, it's not enough fiber for your needs right now.
Okay. That's really interesting. Really personalized. So I think a lot of people have this like conception that more is better. So with like probiotics, like you'll see like the thing they advertise is like 1 billion probiotics. Is more better with probiotics? Like you just want the biggest number of probiotics on the bottle possible, or is that no? See, shaking.
Not necessarily. Again, it's the quality of the probiotic. It's also which organisms are in there. And so there's like one that I prescribe pretty often, and the maintenance is kind of 2 capsules a day for most people. If somebody's dealing with regular diarrhea for whatever reason, we don't really that their tendencies towards loose stool or diarrhea, I will bump it up to 4 a day. And then if it's something like inflammatory bowel disease and they're having a flare up, I can go up to 10. I know this sounds excessive, but 10 capsules a day of this probiotic for a limited amount of time. So no, more is not always better. Like, most people aren't going to need 10 of those a day. Usually 2 will suffice. So, and within the individual capsule, not necessarily. I don't think more is always better, because it is possible to have too many microbes, too many of these organisms in the gut.
Gotcha. So when I think of probiotics, I don't necessarily think of like life-changing results. I might think of, okay, you're a little less bloated, or, 50 years from now, you might live a little longer because your gut was healthy. Have you ever like put someone on a probiotic or changed their probiotic regimen and just like completely like seen their health turn around?
Yes, actually. That's not necessarily the only thing that we did, but I think it's usually the cases where I have seen a vast turnaround is when somebody has that IBS-D picture, where they are dealing with diarrhea and urgency and frequency to the point where these are real scenarios. They do not leave their house until the middle of the day every day because they are having such frequent bowel movements. Like, they literally can't be far from the toilet. They can't schedule anything in the morning because they just need that proximity to the bathroom. I have had people who are in corporate. They are like CFOs, CEOs, and they have meetings all day long every day, and they will not eat because if they eat, they have to go to the bathroom. And so they will intentionally like not eat anything until the end of the workday because they can't sit through meetings without needing to go to the bathroom. For some people like that, if we bring in the right probiotic, and again, there's a couple other tricks that I have, tools that I have, and it reduces the urgency and the frequency of the bowel movements, that is life-changing.
What are these little tricks? You gotta.
There's another product that I like that's immunoglobulins. And so sometimes this high-quality probiotic, it's called VSL number 3 or Visbiome. It's the same, 2 different brands, basically, but the same probiotic blend with immunoglobulins. Those 2 together, for a lot of people, seem to be the right cocktail in, really changing those bowel habits.
Cool. All right. What are your 3 favorite brands for supplements?
Are we talking about probiotics or supplements?
Sorry, probiotics. My bad.
Okay. Brands for probiotics.
Yep.
So Visbiome, Visbiome, and then the one that I think it's more like a direct to physician practices, but the same blend, the same probiotic blend, you can, I think, get just online. It's VSL number 3. Mm-hmm. And Claire Labs, Klaire. I think they might be operating under a slightly different brand now, but that one, they have a high quality, just kind of like maintenance probiotic. It's called Therabiotic, THER-biotic. So I like all of those. Yeah.
Cool. Awesome. Last thing, I'm going to try this share feature here.
Okay.
I got an image for you. Well, while I'm pulling this up, what's your opinion on kombucha for gut health?
Yeah, I mean, fermented foods in general can, again, for some people, can be definitely beneficial. It can be a good way to improve one's own microbiome. It's not the ticket for every single person, but if you feel good on it, it's probably not doing any harm, and it could be helping. Gotcha.
Okay, cool. So lately there's been this big explosion of like these sodas that have like probiotics, or like probiotic sodas. I saw them at the hot yoga studios. I see them at like health food stores, see them at like, the local taqueria, like they're everywhere. Are these sodas with like probiotics good for you? Are they actually helping with gut health, or is it kind of just a marketing thing that makes people feel good?
Think it's probably a marketing thing that makes people feel good. If I had to guess, I would guess that the actual like quantity and specifics of the whatever probiotic is in there is probably not medicinal. And then, whatever the sugar, even if it's, I don't know what kind of sugar, if it's stevia that they're used to sweetening or what they're putting in there, natural cane sugar, that's probably negating the benefit of the probiotic. So again, it might not be doing a whole lot of harm, but if somebody thinks they can drink that kind of instead of like really addressing gut issues or taking a high quality actual probiotic supplement, I don't think that really works.
Okay. Gotcha.
But I do think culturally, I think it's fascinating because again, 15, 20 years ago, people were like, probiotics were kind of like, woo woo. And it was like, kind of nobody really understood it. And, it was just kind of this weird thing. And now they're on soda cans.
Interesting. Yeah. Cool. That's time for us today. Thank you for everyone who joined us live. If you are interested in becoming a patient, just go to the website, click get started, and you can schedule a time with the patient coordinator to talk. Until then, Dr. Rose, thank you so much for joining, and we'll see you in the next one. Bye, everyone.
Hey, thanks.